You're watching LTV, Comcast 34 and FIOS 26, Livingston.
Good day, Livingston, and welcome to Clergy Corner. Today we're going to be talking about affordable health care. When it comes to affordable health care these days, we've been hearing a lot of discussion in the media, amongst our friends, at coffee shops. What is affordable health care? We know it by different names, Obamacare, but it could have been easily Hillary Care or Romney Care. What makes it important for us on Clergy Corner to discuss this today? Does faith have anything to do with affordable health care? Hi, I am Dan Martian. I'm the pastor at the Presbyterian Church of Livingston and your host. With me on the program today, we have Reverend Dr. Richard Vossler. He is from the Grace Lutheran Church. We have Rabbi Cliff Colwyn. He is from Temple Ben Abraham. Anju Bavajan, and she is from the Hindu community. And we have Monsignor Thomas Nightinger from St. Philomena's. Welcome. Let's get right to it. What is your impression about the affordable health care? Tom, what do you think about it?
Well, I mean, to just state right from the start, I don't think there's anyone in America today who wouldn't want affordable health care. I think that's obviously a given. We all want to have affordable health care. Of course, the question always becomes, with many things, is how do we get there? And I think that's the big argument that's alive in our culture today, and with the whole healthcare issue is how do we get there? We do have Obamacare, or at least as it's coined, and that's one way. Obviously, there are many people who feel that's not the way, and there are other, explanations or routes or avenues to get there. Mm-hmm. And so, it's a very, very difficult. It's not so much affordable health care as how do we get to affordable health care? And I think that's the question. And then I think within that, then you have the moral issues that come into play and the faith questions and many other questions that come into play in that discussion that we have.
Well, let's try to unravel those questions. Yeah. Now, Anju, you were down in D.C. for some time. What was the scuttlebutt down in D.C. about the affordable health care?
I think, as was mentioned, most people are looking for some sort of universal health care in America, that people don't get left out, that everybody is included. The challenge is always, what is the right path? And how does it appeal to the different constituencies and the stakeholders that we have within our communities and our country? And in that process, there is always this dialogue and discussion and the push and pull that when you come to the end product, it's not what it's a lot of compromises have been made in coming to where we are right now. So some people are satisfied that at least, yes, it's there. There is a way of getting everybody to have health insurance, but others are not satisfied with the way it has been, it's going to be executed and the way things have evolved. So it's a mixed bag.
Well, going back to the morality issue and going back to how it was been implemented and some of the website issues and all that, those are just kind of things that would need to be worked out. Right. But the interesting thing to me has been the politicians on both sides of the aisle have talked about it. Where has the theologians been? What about the religious community? We have been very quiet, or have I been asleep at the wheel? Cliff, what do you think? Where have we been?
I think you've been asleep at the wheel.
Have I? There we go. Takes a lot of faith riding with me.
I think that, indeed, and I have. I think that many religious communities nationally have been quite loud about this subject. Almost all of them, to the best of my knowledge, in favor of what I would call vigorous, affordable health care. It's a complicated question, of course, but it's complicated in a number of different ways. First, we have the question of how do we pay for it? But second, we have the question, which hasn't been raised yet, of what is healthcare? Healthcare today is so very different from it was 100 years ago, but even 10 years ago. There are kinds of plastic and reconstructive surgery. Do we consider them absolutely voluntary, absolutely up to one's own decision and therefore one's own pocket, or are there things that society should pay for? Scarring left, for example, by the removal of something. I'm not saying which is right or wrong, I'm just pointing out that it's complicated. The analogy that I like to draw is when this country was founded in its early days, education was taken as a given, that every citizen in this country, every child in this country had a right to a free, quality public education. I believe that the only reason healthcare was not made parallel to education in that regard is that healthcare at that time was so rudimentary and it was so cheap as it was. That has changed radically, and particularly just in the last couple of decades, even the last 4 or 5 years, as new technologies and new drugs have been invented, there are healthcare opportunities that never existed before, and they are expensive. I believe that being a citizen of this country should entitle one to quality, affordable healthcare. And while we may have some of the most advanced medicine in the world, when it comes to the aggregate of how our citizens fare in that regard, we seem to keep falling further and further behind other countries that have a national plan and set national standards. None of us are technocrats. I don't know that any of us would know how something best should be structured, but it seems to me that national health care should be not just a national priority, but a national responsibility as well.
Who are we responsible for?
Who takes on that responsibility? The government, the same way that it does with regard ultimately to education. Now, I'm not saying national, specifically the federal government or the state governments. Issues of federalism get complicated, but it has to be something beyond the private sector, because the private sector, as it should be, is always going to be devoted toward maximizing the investment return by those who invest in it, and that's fine, that's the way it should be, but there are a couple of things that have to be focused on achieving a certain result regardless of the costs involved, and I think healthcare is important enough to be one of them.
What about some of the things that are mandated through the healthcare, especially contraception and some of the other, like you said, elective healthcare issues? Is it the responsibility of the citizenry to pay for those type of things?
Well, I like what Cliff said about what is defined as healthcare and what is healthcare, and I think that enters into the very issue you just brought up, because there are certain components of it that that would pose problems. The United States Conference of Catholic Bishops has been one of the more outspoken groups, maybe not more outspoken, but certainly very outspoken with regard to affordable health care, Obamacare, especially and particularly with regard to religious freedom, and speaking about religious freedom and what that plan forces or doesn't force or requires of you. And you brought it up, contraception, abortion, those kinds of realities that have been for the Catholic Church a very big and difficult point of departure, because in effect, Catholic institutions are being forced by that to provide services that go against our moral position, our moral or standing in that regard. As Cardinal Timothy Dolan pointed out in Meet the Press, he said, no group would have been a bigger champion of Obamacare than the United States Conference of Catholic Bishops and Catholics in general, but because of certain components of it, they've been one of the staunchest outspoken against it, because of realities like that. So again, it goes back to what is healthcare and what are what things are there in your tradition.
Right. Well, when we talk about healthcare, can we define this? May we define it for the folks at home about what healthcare are we talking about?
I think what you would talk about healthcare is, keeping people alive, helping them to thrive, would be what it is. It's, as you say, you can't go beyond what the elective type stuff is. I mean, that's a whole line. I don't know where you would draw that line. Where, what is the elective? When you have, so unfortunately, we hear a lot of stories of the good and the bad of what's going on. Whether it is the jail in California, I think it is, that's being forced to pay for someone to have a sex change. I mean, I don't see how anyone could say, yes, that's healthcare. Yeah, that's healthcare. That's not healthcare. That's silly. But by the other hand, there are times where, as a country, we do have to take care of one another. But with the nationalized healthcare that's talked about, sometimes you think the grass is going to be kind of greener on the other side. There are stories I've heard where folks have said that the healthcare in Europe is better, but I've heard a lot more stories where they said that it's worse, that it takes much longer to get care in other parts of
but that's because we're Americans and we want what we want when we want it.
Right.
If I need to get a chest x-ray, because I'm an American, I'm used to it, I want that chest x-ray today. Reality is, if I get it in a week or 2 weeks or a month, it's no big deal as long as I got one every 5 years or whatever. Point is, we have been educated to believe that having all of these things right when we want them is our right, even when they're not really necessary. Why should we have that sort of applicability and that sort of expense if it's not really necessary?
If it's not necessary, that's a whole question.
And I think a lot of countries do manage it. Like Canada has universal health care, many countries in Europe, England. And I think if you want to sort of come out of and they have many of them have really good standards for managing it at a certain level. But if you want to go beyond and you want to expedite something, then there is the private sector that you can go to expedite that. If you want, if it is not necessary for you, and you just as the rabbi said, you want to get it done right now, whether it is required by the doctor or not, then there are other avenues that people go to the private sector.
Are they allowed to go into the private sector?
Yeah, in England you can. You can be, many countries you can go to a private doctor. You're not mandated to just go to you pay for it. There is a national health care, which is universal care for everyone, and you're part of the system, and you go through the system, and you're scheduled and so on. But if you want to get out of it, then you pay for it.
That's one thing I always hear is that in England or Canada, they have the socialized health care, they have the socialized medicine. It's not as good as ours. You have 6 months waiting time, and I'm going, when I visited France and Switzerland this summer, thank goodness I didn't have to do any healthcare type of issues, but I'm going, these people look healthy. These people look like they're not suffering from their healthcare system, and I didn't hear anybody complain about it.
I can tell you, my daughter and son-in-law, they were in Europe, and unfortunately my son-in-law very young person had a stroke, and the French took care of him like that. They couldn't speak the language and stuff, but there was no question asked. They were taken care of. In fact, they weren't even billed right away, and it was like they were taken care of. So I think when there are these kind of emergencies and these kind of things, it just works. The social system works.
Everybody agrees that I think that there was an article on the front page of the New York Times yesterday, I believe, that talks about stitches costing $3,000 a piece. And
they were out of gold, weren't they?
Indeed. And while we may have certain ethical issues which we may view differently, and Monsignor, I want to get into a couple of those in a minute, there is nevertheless a unanimity of thought, I believe, that the system is just totally out of whack and there's no rationality in it whatsoever. Even the capitalists, I believe, those who are strongly against any kind of socialized medicine, cannot make the argument that healthcare costs now are a simple factor of supply and demand. There are too many other factors that are having an influence there. My definition, healthcare is in the eye of the beholder. You posed the question before. What is it? It's what we define it to be. Should it be merely those things that help people who are sick? It's hard enough to define what that is. Historically, we have included things like contraception, pregnancy termination, and other procedures under the rubric of what we call health care. And so, like it or not, we have to contend with them. You referred on the one hand to the Catholic institutions which are being or would be forced to provide a kind of coverage that ethically, morally, theologically they do not agree with. The counter-argument to that is the southern and western states that are trying to, and in some cases have, put extraordinary restrictions on the physicians who can operate in abortion provider clinics, not for any legitimate medical reason whatsoever, but simply to close those clinics down. Then we get into a free speech issue, which then gets into the healthcare issue and so on, only showing us yet again how marvelously complicated this all is.
Why are some so fearful of it? Cliff, what do you think?
I think there's a certain segment of the population that is always going to react strongly to anything that smacks of regulation. Nobody wants regulation. I mean, we'd all like less, certainly in our own personal lives, because I know that everything I do is absolutely right and absolutely ethically sound.
That's why we call you the rabbi.
Thank you, very, very, thank you.
You're welcome.
But there are certain places where it's absolutely necessary. As theological types, we can say to protect ourselves from our own evil inclinations or our own baser tendencies. And I do think that that is necessary. Some people react against those constrictions of any kind. There are those people who simply don't trust the government, and they're not entirely wrong in that regard. There are those people also who are in a situation where they have the personal resources to provide whatever they need, or the opportunity to get the kind of private resources that will provide them or their families for whatever they need. And so they are operating in good capitalist philosophy according to I should do what is in my best interest, and if everybody did that, as the prophet Ayn Rand said, then everything will be
Yeah, a lot of times I think that it's getting kind of spin too, because we forget that people do have health care. The poor people, the poorest among us do have health care. They go to doctor emergency. That's who they go to. If they have a hangnail, if they have a cold, they'll go to the emergency room. Guess who pays for it? The taxpayers. The insurance-sized medicines. The insurance companies tell us what treatment we are going to have and what treatment we aren't going to have. You need a heart transplant. You need chemotherapy for this cancerous situation you have. I'm sorry, your health care plan is not going to cover it.
Yeah, but you know something? I'm going to play the other side of that now, because I don't blame the insurance companies for that, at least entirely. And here's why. The statistics are staggering as to the amount, and I bet all of us have seen this in our pastoral efforts, as to the quantity of health care, the money spent on health care at the very end of life. When it's not going to have any qualitative effect, really, when it's not going to provide, prolong, and extend any quality of life whatsoever, but rather there's this impulse that we automatically do whatever we can. As a consequence, an incredible amount of money is simply flushed down the drain because it can serve no useful purpose whatsoever, except that we've been conditioned to all of this, I want as much as I can when I want it for any use whatsoever. And a lot of the doctors I know don't agree with that, but it's just not a battle they're interested in fighting anymore, plus they have an economic incentive not to fight it.
Yeah, Rick, let's get Rick in here.
Yeah, you had asked about what do people fear, and I think people fear who is going to control the healthcare system, who's going to control what type of healthcare you get. Whether is it going to be the government, is it going to be the insurance company? Do you trust that person who is controlling it to act in your best interest? And that answers with what you're saying as well, that the doctors, why some are doing it, that they don't want to get sued or whatever it is. They don't, they're protecting themselves. I agree that the insurance, the healthcare system needed some tweaking. Do we trust that Obamacare is going to be the correct way to do that? I don't think so. Or do we trust that the government in general is the one who's going to do it? I think more people trust that their insurance company will have a better, more of their own interest at heart, the patient's interest at heart, closer than the government would.
But the insurance companies are very heavily engaged in this whole process of managing the health care.
Not only that, as they have been managing, the prices have just been going through the roof.
And I think, having so much involvement with the health insurance company is not such a good thing. Other countries don't necessarily have the private health insurance companies that involved. The government actually does a lot of that work, but I don't think Americans would go with that, handing it over to the government completely, because that's the history history of America.
Well, you know, and I
What's
think-
going to cost? What would the cost be of if we were to go to a European model where it is the healthcare is paid for by the government? Then what's the cost going to be in taxes?
The governments do keep, yes, the taxes are higher, but people know that they're taken care of, throughout their life cycle, basically. So
Yeah.
in a way, it eases the burden on that, and people do live healthy lives, and they're doing a lot of things.
Yeah. Tom,
Well,
you were going to jump
I
in
think
here.
the issues that have been being discussed are very, very important, and they're all very much a part of the conversation. But Dan, you asked a question before about what's the fear, and the fear, I think, is even going back to a more fundamental level. And I think there's all of us know someone who is very seriously ill, very seriously sick, terminally ill, or
Right.
very, very, very badly sick. And I think there is a fear in all of us that same thing can happen to us, and that we might not, that we might not be as healthy as we are today, that it could be something, that would really, really just turn our life around. And then linking up the fear to that is that the health care that we want or that we're going to need at that point is not going to be there for us. And I think that's where the fear goes. I mean, I think it can go, dare I be dramatic and say the fear of death, but the fear of sickness and death, is I think very much alive. And I think, we want to have a healthcare system in place that will be there for us when we need it, and a healthcare system that we can afford it. We've all heard the horror stories of people who are very, very seriously ill, or confronting some illness that is prolonged or even lifelong, and they get that letter from the insurance company that says you're not covered, or
you're
whatever.
canceled.
And so I think that's where the fear comes from. I think that's where the fear comes from, and I think that's why these discussions that we're having right now are all the more important, because there are political implications, cultural implications, religious implications, and all those other realities.
Well, what do you
that
think
come
some of
into
the
play.
religious implications are? And let's move into a different direction here as far as the moral, the justice issues, the theological issues, the religious implications. Tom, would you like to?
Well, I certainly think, in our tradition, very, very clearly, we see Jesus as one who was a healer, who was a miracle worker, who was trying to bring about cure. I think sickness and death are part of things that entered into the world, not according to God's design, but entered because of the misuse of the free will that we were created with, and it came into the world, and it's been something that we have been struggling with and struggling against for ever since the dawn of creation. And so it's not the world God created us to be in or to live in, and we've been trying to find our way back home. And that's a very, very difficult kind of, on a much more fundamental level. And sickness and death and those realities remind us of our mortality, whereas our faith reminds us of our immortality.
What do you think, Anju? What are some of the moral implications
Well,
here?
in our tradition, the focus is on wellness, yoga, meditation, Ayurveda. All of that is that you live an integrated life and an inside-out approach, and eat the right food, live the right way, so that the body, mind, and soul connection is all there, and you're living from that perspective. And then taking care of those who are in need is also an integral part of our life. That on our, what we say, moksha, the path of salvation, the first is compassion. You've got to open your heart and have compassion for others. So taking care of all of that is there. But a lot of focus is on preventive medicine, as we would
Right,
call in
right.
the terminology here, of taking care of yourself in an integrated way, eating, and our food and everything is meant for that kind of an integrated.
When it comes to affordable health care, have we elicited a conversation, dialogue, discussion with our congregants on the theological implications of everybody covered? Rick, what do you think? What have you talked about?
In our congregation, we've talked about about the care that we have for one another, and the importance of looking out for one another. Certainly, that's been part of the discussion.
But when it comes to everybody having universal health care, everybody covered health care wise, is that a theological discussion that we want to get into, or are we too afraid? Because that kind of deals with taxes and tax base, and our taxes are going to raise, and we don't want to talk about it because there's some conflict, there are some challenges. People are they don't want to hear. They know, yes, everybody should be covered. We love everybody. We're all made in God's image. But if it's going to raise my taxes, no way. No way. I don't want that.
I find a diversity of opinion in that regard. There's universal, maybe that's not the right word to use in this context. there's general consensus, I would say, among our members of our congregation that, and there's no great novelty here, that everybody should have access to affordable health care. Health care as we mean it in the most basic sense. Hardly anybody except a few of the persnickety libertarians in the group would argue that those who for whatever reason simply don't have the access and can't afford it are left to their own devices, which is a particularly hardcore approach. So 99% are absolutely in line with that. Where the divergence comes, of course, is not the end but the means.
Yeah.
I'd say many people are open to what Obamacare is trying to do. They've been tremendously disheartened, and appropriately so, by the rollout. Although, as has been pointed out many times, the same thing happened with the Medicare Part D rollout under the Bush administration several years ago. Hopefully things will be different. I think the big concern, and this goes back to something, Monsignor, that you said, is that all of us have and will continue to have coverage that will make us feel safe. If I can be made to feel safe and secure and not be looking at some enormous cost increase, whether through premiums or taxes in the near future, then I would be okay with that. And while people may agree with Obamacare in theory, they're a little leery right now based upon the execution of the rollout.
And I think we should keep in mind that any change, regardless of what changes, always creates a bit of an anxiety and fear that what is it going to be and how is it going to be. So we all have legitimate concerns, but there is also that fear of change.
As faith communities, how are we lessening that people might have, the anxiety that they're exhibiting about this issue?
Well, we're doing one thing which we're in a wonderful position to do, which is helping some individuals, and that is we have a nurse on our staff, and she is familiarizing herself with Obamacare, and we are making her available as a resource to congregants who would like to know more and think that it might be helpful to them, or at least to steer them to the right places, because I think people have been so overwhelmed because of the poor rollout of the plan that they're really not sure what to do next. And so I think any kind of direction that can be helped in that regard would be good. And in that sense, I also want to commend the Star Ledger, which has had a series of excellent articles over the last several weeks explaining Obamacare, how one signs up for it, what is covered, what's not covered, how it works, and so on.
Well, I appreciate you being with us today, and I think the word is education, and that helps us with the faith communities, helping us to talk about this issue, and just being available to be there for the folks as this whole thing comes about and as we peel off the layers. Well, thank you very much for being on Clergy Corner today and for your insights and your thought-provoking conversation. And for those at home, thank you very much for tuning us in today. We're going to be doing something a little bit different here at Clergy Corner. For those that would like to be part of our studio audience, I ask that you would go ahead and contact me via the Presbyterian Church of Livingston or on our website, which is livingston-clergy-association.org. If you have any comments or questions, please send them to our website. Thank you very much for being with us. Until we meet again, may God's peace be with you.